All right. Anybody else? Is that everybody? Go ahead and press that button if you haven't yet. Okay. All right. Yeah. So most of you are saying the obvious answer. Since we're talking about head injuries, it should probably be head and neck injuries, which it is. And yeah, so we're going to be talking about some of those causes right away. All right. So yeah, head and neck injury stats. So 70% of death and 20% of disability from sports occurs due to head and neck injuries. Okay, so that's a large majority of death and some percentage of disability related to sports. Right. One of the big ones is concussions. Right. How many people have had a concussion at some point in their life? Yeah. Okay. Not as many as I would quite expect, but yeah, quite some of you for sure. So the definition of a concussion is immediate and transient impairment of brain function. So you got hit on the head, you had to stop rapidly, you accelerated rapidly, some kind of impact to your skull, and you have some impairment of brain function. So that could be memory loss, that could be a little bit of loss of consciousness, doesn't have to be. That could be dizziness, that could be nausea, that could be just a bad headache. Any of those things can be considered a concussion. And so the cause of it really is, just like we're talking about, either a direct blow to the head, could be acceleration or deceleration forces that pretty much take the brain and like shake it around inside your skull. Okay. And so when you have a direct blow to the head, you'll usually get two different spots, two different locations on the brain where you get injuries. And so the place that the skull actually comes in contact with something, so like your head's going forward, okay, or this object's coming towards you, right? And it stops right there when it hits the object. The brain keeps moving, right? And it hits the front of your skull, right? That's called the coup injury, okay? But then right after that, your brain bounces off the front of your skull and it then hits the back of your skull right after that. And that's called the contra coup injury right there. So then you can have damage in the other side of your brain, the part that you didn't even hit at all, right? So you kind of end up having a lot of times damage on both sides. Could be from the side too, right? Then it's like this side and then bounces over to that side, right? So the coup and contra coup injuries. The big thing about is that nothing shows up in imaging, right? So there's no bleed to the brain. There's no actual, you can't necessarily see anything in any of those CT or MRI scans, definitely not an X-ray. You won't see anything, right? But there's just kind of this impaired function in the brain. So, but the concern that we have, at least the biggest immediate concern that we have with somebody who's had a concussion, especially young people, is called second impact syndrome. Okay, and so second impact syndrome, sorry, those are supposed to be little arrows, is when somebody has a concussion and not all their symptoms have gone away yet, and they get another impact to the head. And it just results in this kind of offset of homeostasis where the person gets uncontrolled bleeding in their brain, and they can be dead within 5 minutes or less. It's called second impact syndrome. And it really only happens in young people. I think maybe the oldest somebody has been is like 21 or 22, somewhere around there that's had this. So it's just a developing brain thing. And so, yeah, sometimes they have loss of consciousness. That's what LOC means. And sometimes they don't. But within 15 seconds, their condition degrades very, very rapidly. I'm going to show you a little video on this that is an older video, but it's still, I think, kind of the most powerful narrative and story out there that kind of shows the negative impact of this. So, yeah. So let's go ahead and switch over to that.
Life was good for Preston Plevrides as a senior at Marlboro High School in New Jersey. Yes. He was charismatic.
And send in your answer.
Caused by the second time potassium kind of goes out.
Yeah, they don't really know. Yeah, it's not really fully understood. I think there's something to do with those, with the ion changes, but they don't really fully have it figured out. Yeah.
So when it says even when exercise, that mean like going back and play your sport or like if like I could be like in the gym.
Playing it without the impact, kind of trying to simulate it, sort of. Yeah. Mhm.
Yeah. Wait, can I ask a question?
Sure.
So when you have normal symptoms, right, don't you have to like not go to sleep or something? Like, what does that mean?
Yeah, that was kind of an older thing. That you had to like get woken up every 2 hours kind of thing. It was always like a fear that they wouldn't wake up or that like a bleed would start. Yeah. And it was kind of always the idea that maybe they have a bleed happening and we just don't know yet. And it's like showing as a concussion. It's not really the current protocol to like wake people up that often, but yeah, but it is. I mean, there's still a slight risk of like a real slow bleed in the brain that we don't know about, and it's like slowly building up pressure overnight. And that was kind of always a concern, but yeah, it's not really the recommendation anymore. Yeah, yeah, yeah.
Are you letting Dr. Sawyer
Ah.
like get like the whole?
No. Sorry. Yeah. Yeah. Oh yeah. Luckily, no, none of our kids want to, except our daughter. She really wants to. Because she watches the show Bella and the Bulldogs. Have you guys ever seen that one? Yeah, she's like, she wants to be Bella for sure. That's gonna work. So, all right. Um, and this is kind of at that point, that was kind of a new thing. First, it was just like, yeah, well, we'll check all your symptoms. If everything's gone, you're good. Right. But then the next step is make them go exercise, make them run, make them jump, make them do all the things they would have to do. And then a lot of times symptoms will come back with that. Right. And so the symptoms need to be gone with exercise, with kind of simulating the sport that they're going to be doing. So yeah, so that's kind of the key thing now is kind of all that return to play testing with simulation of what's going to be happening actually on the field. So yeah, questions on that? Yeah, just
So it's just about symptoms and not differ between people, because I think they said with him, it's like a month, right?
Yeah.
It's a fourth.
hmm Yep, yep. So he should have technically, like with nowadays concussion protocols, he would have never been cleared to play. Yeah, yeah. The soccer girls know this. I know we got a couple soccer girls in here. You probably have either of you had concussions with this? Yeah. Have you been? No, you haven't, but yeah, you had Lily. Yeah. Two already. Yeah. And how long have you had to sit out with them? Yeah. Yeah. So it's not like in the past, it was just like, yeah, you kind of got your bell rung, get back out there, kind of thing. And it's like, yeah, now it's like taken very seriously. It's very common to sit out for weeks to a month sometimes with a concussion, maybe even just because you just still have the headache, right? And that might be your only symptom left, but you're not cleared to go back until that's gone. So yeah. Do you have a question, Toby? Yeah, concussion too. Okay. Really? Wow. Yeah, okay. Okay. All right. Okay. What, what concussions kind of on the long term is what's called CTE, and that's kind of more what that concussion movie with Will Smith was about, right? Chronic traumatic encephalopathy. And so if you remember the images of Huntington's disease, which is that chronic brain degeneration disease, it doesn't look that much different than a brain with CTE, right? Where the brain just completely deteriorates. And this is linked to multiple concussions throughout a long period of time. And so we see this in a lot of NFL players post-mortem. We see this in a lot of boxers, things like that. And so it leads to these very serious symptoms that a lot of times ends up resulting in suicide or actually just very terrible things. Like one former NFL player murdered his wife and then killed himself, right? And so there's just this, yeah, and a lot of that can be linked to CTE. Problem with CTE is it's only diagnosed post-mortem. So by taking the brain out and actually like looking at it. I'm just going to show you another quick video here. When I was a student here, when I was a senior here, and then the year after I graduated, I worked with San Diego Chargers, and Junior Seau was on the team that first year. And so this one kind of hits home with me because he was somebody I knew, and he committed suicide because of CTE. And so it's just a brief little story on him and what he went through. So
Those were their closing
sorry.
comes from any. That's why I started PACA. 10 years ago, I was traveling on a backpacking trip through South America and came across this.
There it is.
this way.
Skip. Pathologies to the central nervous system. So CVAs are cerebrovascular accidents. These are strokes. Okay, so a stroke is the most common nervous system disorder in the world, and it's the third most common cause of death in our country. And there's two primary types. The first type is called ischemic, and this is pretty much like a heart attack of the brain. Okay, so there's a blood clot that happens. It gets lodged in an artery in your brain, and then we lose blood flow beyond that clot. Okay, and then brain cells die, neurons die, and we get permanent damage to the brain. So that's an ischemic stroke. Can also have a hemorrhagic stroke. Hemorrhagic stroke means that instead of a blood vessel getting clotted, it breaks, and we have bleeding in the brain because of that. Instead, they can both lead to permanent and severe damage to the brain, but the treatment is very different. Okay, so when somebody has a stroke, there's a real timeline of events that's important. If you can get somebody who's had a stroke to the hospital and to the point of treatment within 2 to 4 hours, you can break that clot if it's an ischemic clot or ischemic stroke and save some brain tissue. There's a certain drug given that we'll talk about in just a second that can help break up that clot. So pretty much with a ischemic stroke, we're trying to do something to break the clot so blood can continue. With a hemorrhagic stroke, if you give that same drug, that's the exact opposite thing that you want to do, right? Because we already have bleeding in the brain, right? So if you give a clot-busting drug in a hemorrhagic stroke, you're just leading to way more damage, right? So getting them in to get that MRI or CT scan to see if there is bleeding is the most important part to make that decision. Okay. All right, so we also have something called TIAs or transient ischemic attacks. So these are kind of also known as like mini strokes. Mini strokes is when we have a temporary blockage of a cerebral artery. And so a lot of times people will get some numbness or some paralysis on one side of their body for just like a minute or so, or like 30 seconds. Sometimes they'll kind of just like zone out for a second. They won't be able to talk to you for a second. Kind of have this like altered consciousness, and then they kind of wake up, and those are kind of symptoms of one of these TIAs. So similar to when people don't have a full heart attack, they have what's called angina. They just have like temporarily impaired blood flow to their heart. It's kind of the same idea with these mini strokes. Same thing. No permanent damage caused from that, but it does put you at a much greater risk to have a full-on stroke as well. Go ahead, Toby. Yeah.
Absent seizures be like
What kind of seizures?
absent.
Absent seizures? Yeah, I don't know that term. Is that kind of the same idea where they're kind of like, yeah, I think this can be a cause of that. I don't think it's the only cause of that, but yeah. Mhm. Okay, so as I said, one of the most important things with a stroke is noting the time. This is like a little acronym that is used to kind of just quickly assess if somebody's having a stroke. And so it's fast, right? So you check their face. A lot of times there's some drooping of some of the facial muscles. A lot of times they can't lift one arm, but they can lift the other one. A lot of times there's some slurring of the speech. And then again, noting what time the symptoms started is super crucial, because if you're the one actually that first sees somebody having a stroke, noting that time is important because you can tell the people at the hospital how long it's been since symptoms have started. If it's been over 4 hours and they give that clot busting drug, then it can lead to more damage actually. So knowing the time is crucial for that reason. Okay. All right. Go ahead and talk through this one. Answer it with your team and send in your answer. Say it again.
This one,
Specific treatment. Yeah, they would.
not the clot busting.
Yeah, they could do the opposite. They could give some drugs that help you clot. Sometimes it just needs surgery right away. We have to get in there and try to pinch off that vessel. So yeah, yeah.
Break the, how they got.
All right, go ahead and send that in. All right, so most of you are saying B. So clot busting for hemorrhagic strokes, all right, which one is not true, right? So that's the opposite. So treatment, all the other ones are true, right? So treatment for the two types of stroke is very different. Clot busting medications only work for ischemic strokes. If we do that in a hemorrhagic stroke, it could be fatal. And we could save brain tissue if it's done properly. So yeah. Questions on that? Okay, so a couple other disorders here. So Alzheimer's disease is a progressive degenerative disease that leads to neuron death and the brain shrinking, similar to what we just saw in CTE. There's two kind of primary pathologies that kind of really are seen a lot with Alzheimer's disease. One is called beta amyloid plaques in the brain. Okay, so it's kind of like outside of cells. It's just pretty much like all this scar tissue that's seen in the brain outside of neurons. And then inside of the neurons themselves, another type of protein called tau protein kind of forms inside the neuron and even in axons of neurons and kind of tangles up around different parts of the neuron. And then the third kind of degenerative piece that is seen as those microtubules that we talked about. Remember those microtubules that neurons use to transport things down the axon back and forth? Those degenerate. And so then if we're not able to carry components down to the end of a neuron, then that neuron's going to degenerate and die as well. So those are three of the kind of key things that are seen with Alzheimer's disease. So Alzheimer's disease is one of the main causes of dementia, which is just mental deterioration with lots of symptoms related to memory, disorientation, language changes, mood changes, hallucinations. There's definitely a genetic component to Alzheimer's disease, and it's one of the diseases that's on a sharp rise right now in our country. Right? And so the estimates are back in 2010, it was only about 4.7 million people. The estimates at that point were by 2050, there'd be almost 14 million people with Alzheimer's disease. A big part of this is because it's directly connected to type 2 diabetes and high blood sugar levels. And so people with high blood sugar have a much, much higher risk of Alzheimer's disease because that glucose actually destroys our neurons in our brain. So much so that if you look up type 3 diabetes, which isn't really a thing as far as diabetes goes, it's referring to Alzheimer's disease because it's so closely linked to diabetes. Okay, Huntington's disease, we talked about this one just a little bit when we talked about genetics at the beginning of the semester. But yeah, it's a fatal hereditary disorder and occurs usually sometime, usually kind of onset sometime around like late 20s into the 30s. Yeah, it's fatal within 15 years of onset. There's potential for some stem cell treatments to help cure this, but nothing yet. So that's a tough one. There's really no treatment for it. Definitely no cure for it. Parkinson's disease is another degenerative disease of the brain. We've already talked about this being those dopamine releasing neurons in that part of the brain. We talked about the substantia nigra, right? So they have an inhibitory role. Dopamine has an inhibitory role in that part of the brain. And this leads to kind of overactivity of certain muscles because we lose the inhibition there. And so tremors, this bent forward walking posture, shuffling gait, very stiff and kind of jerky facial expressions. Again, this is something that stem cell work is being looked into for as well. But yeah, a tough disease for sure that doesn't have a great prognosis. And then lastly, MS, multiple sclerosis. We talked about this one a little bit already, but this one involves loss of oligodendrocytes, remember those cells that help us produce myelin in our central nervous system. And this is an autoimmune disease where the immune system is destroying those oligodendrocytes and the myelin that they create. And this definitely has a genetic component as well. typically the onset is somewhat early in life, between 20 and 40, and it's a very painful disease with lots of numbness and tingling and things like that. And currently no cure for MS as well. So yeah, well, let's finish with this clicker question here. You can go ahead and put in all that apply. Check with your teammates on this one and send it in.
Like.
Oh, yeah.
You know, I haven't teach you that Alzheimer's is related to type 2 diabetes.
I know, isn't that weird? Yeah, yeah, I know. It's like somewhat new information, but not that new. Yeah. It's one of the many reasons, but yeah, it's what's called glucotoxicity, which is pretty much like that destroys our blood vessels. It destroys a lot of things. Like that's why we get like neuropathy and stuff. You know, you lose blood flow to your toes and stuff, but then it destroys neurons directly as well too. Yeah, yeah. All right. All right. So C and E. Yeah. CTE is mostly because of the trauma, right? There might be a genetic component. We just don't know about it yet. Parkinson's also is no known genetic link at this point, but the other three for sure. So, yeah. All right, guys. Have a great rest of your day. We'll see you on Friday for our last class. Yeah.
This one, I don't know if I got